Hi, my name is Tanya Marvin. I'm the coordinator of nursing services for the school district. We've been in school, this is our 4th day now, and so it's time to let you know more information about how we're going to handle sick children at school. All of you are hopefully aware of our self-reporting tracker system. If you are a parent of an elementary student, we're asking you to go through Parent View and check that the symptoms there, if your child has any symptoms, or if not, you just push the submit button. For those kids that are in middle school and high school, we ask that they self-report, and they can do that through Student View. If for some reason you're not able to do that at home, then on site, when your kid gets to school, we will have on-site screeners. We'll be looking for the exact same thing that the self-check symptom screener had. And so with that, if we discover that the student has a major symptom, and that could be a cough, a fever of 100.4, or minor symptoms. It takes 2 minor symptoms like a runny nose and a headache to get the alert that says you're not cleared to come to school today. That screen will give you the pathway that you should follow. If your child is on school grounds and we find that out, then what we'll do is we'll bring him into our room where we're going to keep kids who are sick. We'll keep them separated from the other students that are just coming to the health office for first aid. We will give you a call. We'll ask you to come and pick them up, and we'll let you know what symptoms they have. And again, we'll give you the pathway for what you should do next. So here's what the pathway is. After you report symptoms, or we discover symptoms at school, we're going to basically have 2 pathways for you. You can call your primary care physician and talk to their triage nurse and find out if they want you to go to be tested, whether they want you to come in and see them because they think it might be something else like an earache, something like that. Or you can call the Mesa County Health Department to make an appointment for sampling. Mesa County Health Department has really expanded their services right now. They've increased the testing time every day, and those tests are free. Anybody can go and ask for a test, whether you have symptoms or not. So there should be a pathway for you to be able to follow. If you decide not to follow either of those pathways, because your student has reported symptoms that are associated with COVID-19, they will be out of school for the next 10 days. If during that time you decide to get them tested and they have a negative test, then of course they can come back. So anybody who is symptomatic and has a negative test result, we ask you to bring that result to us, and they will be allowed back in school. After that, if you actually get tested and you actually have a positive test, then that will be a different pathway that we follow. There's nothing in our medical community that triggers me when somebody goes to get tested. So that's not information I can share with you. If parents want to share that with us, we are happy to take that information. But we are informed of positive test results. By law, the health department is notified of those results, and in turn, they'll notify me of the results. They'll be in contact with you. The health department will be in contact with you, and they will ask you about close contacts. Who have you been in contact with? They will develop that list. If they need more information, they'll call me, and that I will give them the information, who was in the classroom, who might be on the bus with them. After that, the health department does what they call contact tracing. They're contacting those major contacts, those close contacts that you've given them, and they're determining whether they are at risk. meaning they have been exposed to somebody who is positive. They assign a risk. It'll be a high risk, a low risk, a no risk. And so out of one incident, everybody is not going to have the same result, most likely. If you're a high risk, then the health department will say you'll be under quarantine. Quarantine lasts for 14 days. A negative test will not get you out of quarantine. The reason quarantine is 14 days is because that is the incubation period time for COVID-19, as far as we know now. So we will enforce that quarantine, and we will not allow your child back into school for those 14 days. Now the classroom and the school will have a plan for this. They've already made plans for how your child will continue learning during that time. This is just a brief overview of that. Every school will be following the same pathway. We really want your kids to be in school. It's very helpful if everybody does their part. Don't send sick kids to school. Whether they're sick because of COVID-19 or flu or the cold, because all those conditions have symptoms that are very similar. We can't tell by looking at your kid if they have COVID-19. The only way to know is a test. So we appreciate when you keep your sick kids home. We appreciate the communication that you give with us, and we're looking forward to making this a successful year. You feel free to contact your RNs at the schools if you have any questions about that. Also, you're free to contact me. My office number is 254-5417. Thank you.